These are the two most important things that your early intervention therapist should be doing so that you can get the most out of early intervention. I'm going to tell you what they are, and then you can ask your providers if these things are happening. The first thing that your provider needs to do is parent coaching. You are the expert on your child. You know them best. It should be you and the therapist brainstorming together to figure out, what do we want to try to help your child eat or walk or talk? What have you tried in the past? What's worked? What hasn't? How does your child learn best? And what are you the most comfortable with? What feels doable for you when that therapist walks out the door at the end of the session? When you figure out what those things are, your provider can help you learn how to do it. Whether it's like reading a book differently, modeling a word. By the end of the session, you should feel pretty comfortable that you can do that thing because you've practiced it with your therapist. And listen, if you desperately need a break, take it, but most of the time, it should be you working as equals on the team. The other game changer is that the professionals on your team need to be talking to each other outside of their sessions. Ask them if they're doing this. When they talk to each other and they share information about what happened in your sessions, what strategies were effective, what they're working on, what your priorities are, everyone is on the same page, and it prevents you getting just like a ton of different advice from different people that leaves you completely confused and unsure of what to do next. It shouldn't be your job to make sure that they're doing that, but now that you know that they're supposed to be, go ahead and ask them if they are.